Dr. Steve, we were just talking before you got here how difficult it is to get off of opiates.
Yeah.
One of the most difficult things there is, right? Opiates?
Sure. Other than tobacco, which I think is one of the hardest things to get off of because it's so socially.
What about sugar?
Sugar's difficult too, not addictive in the same way. I don't think it works in the same pathways.
Have you ever tried to kick sugar, though?
Yes.
Everything just comes pouring out of your body.
It's very
You're like,
difficult.
what is wrong with me?
Oh, yeah.
What is wrong with me? And you're like, oh, yeah, the sugar thing.
Yeah. I'm a fan of the Sugar Busters diet. It's an easy way to get off sugar.
Well, I do it, but I also have some M&M peanuts just to make it a little bit easier.
Right. Opiates, difficult. And, this Suboxone thing, it was designed originally for people who didn't want to go through the stigma of going to a methadone clinic. And so you got to go to a special clinic and you got to be treated by a special doctor and you got to take a special medicine. So the whole purpose of it was to allow family physicians and internists to do opiate addiction treatment in their own offices. So you could just go to your own doctor. And all they had to do is take a little test. You get this XDEA number and you can write it. But it didn't work out that way. A lot of the family practitioners and internists just didn't want to mess with it. So now they opened up these methadone or Suboxone clinics. And now we're back to the same situation, except now it's a cash paying thing rather than federally funded. And, it's what I see is a lot of people staying on Suboxone forever.
Sure, why not?
Where
it's nice high.
Originally, we were supposed to, put you on it and get you under a maintenance phase and then wean you off of it over 6 weeks or whatever. And studies show that if you wean somebody off Suboxone in 7 days, it's the same efficacy if you do it over 6 months. So there's really no reason to keep people on it forever.
Well, you get that extra, 5.5 months of partying.
If you have chronic pain and you are addicted to opioids, then Suboxone's not a bad choice because it's a really good pain medication, too. And the theory behind it is if you take a narcotic with it, then you'll go through withdrawal. And that was because it's the way the molecule works. It's what they call an agonist-antagonist, meaning that in the absence of a narcotic, it acts like a narcotic. But in the presence of a narcotic, it acts like a narcotic blocker.
You always like you always tell me, have a little Valium kicker. Just because that was always the methadone thing, that you would do methadone, use a kicker, and then you literally spend the weekend just smoking one cigar. Oh, this was good.
Methadone's a fantastic drug for pain. It's very underutilized, but there's problems with it.
Yeah, you could fucking drop a cigarette on your balls. That's how good it is for fucking pain. All right, let's play this game, and this will be part of the Weekender. What was the first soft drug you've taken, and then the first hard drug? Now, I'm talking recreation time. So you got to think to yourself, how old were you when you leaped from one to the other? Chris Stanley?
Okay, soft drug, I was 16 and smoked a joint for the first time.
I'm very surprised you waited that long.
Yeah. I was always drug culture always interested me, but I just never smoked any weed.
You were never around it enough.
Exactly, yeah. And then I was on a stoop in Park Slope outside a house party, smoking a joint. That was the first time I ever smoked any weed, and it was great. And I was like, the hell did I wait so long? This is ridiculous.
That is the weird thing about being a kid and doing that. You do have that initial feeling. All right, what's the first hard drug you took?
And then a year later, the first hard drug was LSD. Some dude named Whiskey was the guy. He sold me.
He seems trustworthy.
Scraggly looking dude older guy sold me double dipped acid. Ate it and tripped face for 14 hours or something, and it was just fucking nuts. I thought I split into two at one point, and that's no bullshit. I honestly
people
thought
always laugh at people's acid experiences.
I thought I split into two
they're
people.
Silly.
And that was probably the first real hard drug that I ate. And it was awesome.
I'm going to play this with Fez Whatley.
First soft drug, 16 years old, smoked marijuana at Disney World.
Shocked by this one. Now, what were you doing at Disney World? Did you smoke with one of the characters?
No, I did not, but I wanted to.
Yeah.
No, just went with friends. They brought it. We did a trip over to Disney, and so I just joined in.
You smoked during the daytime standing inside the theme park?
It was... Yeah, we did smoke inside the theme park, but I know it was darker out. So it might have been towards the end of the night.
And did you jerk off right after?
No, I did not.
Because I know you were an outside masturbator as a young person.
Just for a while.
All right, so that's your first soft drug, which I'm surprised Fez Whatley at 16. I would have thought much older for him.
And then it was forever before I ever smoked it again.
Oh, you didn't pick up, you didn't?
No,
you didn't care for it?
No, it didn't I didn't like the feeling. It didn't become a regular thing. Mm-hmm. I think that was my only high school marijuana experience.
And your first hard drug?
Hard drug? I probably have to flash forward about 15 years.
Uh-huh.
Shit.
About 30 years old, having a roofie.
And what got you to do that, Flipper?
Yeah, that was just, all right, everyone's trying this. It really was self-imposed peer pressure.
Yeah.
Because no one was telling me to do it.
That's so fucking funny. I remember we had done this because we were all just eating fucking roofies like crazy people. And when there was we did some show that this woman had eaten she had eaten some roofies, got up in the middle of the night, and had eaten a birdseed out of the fucking cage or some shit like that, right? Oh, man. So we're lying on the floor laughing. We think it's the funny thing ever. So one of those terrible magazine shows calls us up. I don't know what it was.
Yeah, I'm trying to think of what it was. It wasn't PM Magazine.
Something bad.
But something like that.
No, but it was national.
Yeah, it was.
So it was like one of those ones like whatever Bill O'Reilly used to do before he went on.
Inside Edition, I think.
Something like that, yeah. So they called us up, can we have the audio? And we're like, sure, it's fucking hysterical. And then they came down, they go, we want to talk to you guys about, because you're all saying you're eating it. And we're like, we're going to put Fez on with you because we wouldn't do it ourselves. So he went on that show and you're like, I'm addicted or whatever the fuck it was. I'm an addict.
I have to have them and take it with this beer.
Yeah. And I remember that it ran and I'm at my house laughing. And then my dad called me, and then my uncle called me right after. What the hell is Fez doing? I'm like, why are you guys watching this shitty show? And like they made it out like it was the worst, we were the worst show, and we thought it was funny that people ate birdseed.
Drug pusher.
Yeah. Let's go to Dennis. And by the way, you can put these up on the iBank. Liz Zed's Fire puts soft drugs as cigarettes. She says cigarettes at 12, weed and booze at 13, acid at 14, everything else after that 15 to 16.
I got her beat on all of those.
Fun fucking times. What is yours?
Well, let's see, cigarettes in second grade. Mm-hmm. First time I tried them, stole them from my mom. And then my parents had friends who had a boat. And for some reason, they thought it was a good idea to have the 11-year-old Boy Scout who was going to camp the next day make drinks for everybody on this boat.
Sure.
That had a cabin. So every time I would make a drink for them, I would take a shot myself. And I was bringing, they said, I want a whiskey. And I would just fill up a tumbler full of whiskey. And they were like, oh, these are really, very strong drinks, young man. And I got completely hammered off my ass. And I think, puked all over the cabin and just rolled around like an idiot. And the next,
in front of the adults.
Yeah, yes. And then the next day, I told my dad, well, I was tired, and he was like, yeah, tired.
Yeah, we all were.
Yeah, we were all
stuck it out.
So, and then pot at 14. I did hash with my friend Joel in his basement.
How was hash? Good.
It was awesome.
Yeah.
Yeah, I saw things. Jungle gyms made out of neon lights and stuff. So,
I forgot. I didn't know that we were considering cigarettes a soft drug, but it is a good call. And I'm just like you. I remember me and my friends would get steal a cigarette like in first and second grade, and then we would go out in the woods, smoke it, and pass it around like it was a joint, and bitch about people lipping it. I'll just use that. Okay. I'm going to use half of a compound word and say lipping it. And Also, you don't inhale. You don't French inhale. Right away is a contest.
Sure.
And I remember thinking to myself, smoking cigarettes with your buddies is fucking great. Drinking, I had a very bad hangover in 5th grade and was sent home, but I wasn't like a regular drinker. Then I stole alcohol. I became like a regular drinker, 13. Wasn't until I was 14 till I smoked a joint. I thought to myself, I'll be a fucking drinker, like a greaser. And that is it. I don't want to smoke pot. And I even had some friends going, what is with you? You're fucking like a pussy. Or another word I'm not going to say, Fez.
Thank you.
Fagula.
Fathead.
Smoked at 14 and immediately went, those fucking liars, and did acid within a week. Did LSD 25 within a couple of weeks of that. The strongest acid I've ever had in my life. And never turned a drug down after that because I thought they lied about marijuana.
They did.
But now, in hindsight, for what I know, as soon as I started drinking, I basically showed alcoholic fucking tendencies of this is great.
Yeah.
You know what we ought to do tomorrow night? Drink some more. You know what I mean? Like one of those kids. Here is Mike. Mike, you're on the Ron and Fez show.
Hey, Ron. You guys are like kind of touching on it a little bit, but when Chris said like LSD is being a hard drug, I guess my definition, I'm wondering what your definition is of a hard drug, because mine was always like the kids that got into, the junk or the pills, and none of my friends ever were addicted to LSD or anything like that. So I always considered hard drugs to be those more addictive drugs. So
I could see how you would do that, but at the same time, now would you want to see a 14-year-old kid doing LSD? Would you think that was a positive thing? I mean, I'm frightened of what I did to my psyche at that age.
Well, then,
do you think that affected you? Cocaine did, though?
What's that?
Do you think that affected you worse than the cocaine or the heroin?
I would say this. Once I did LSD the first time, that ended any interest I had in playing sports. I went from playing sports every fucking day until then, and then I was like, I have a new sport, and it's called fucking with my brain and fucking with reality.
It's experimenting.
I think if you were the type of person who waited later in life until you had a little bit of philosophy and some psychology and had thoughts about spirituality, it would be a lot smarter and a lot more interesting a thing to done than just sitting there and listening to fucking Pink Floyd with a cigarette trying to make as many trails as you possibly could. Do you fucking see this? It's like a goddamn lasso. Is it happening? Is this fucking happening, or am I just saying it like that?
It's happening.
Because I could not understand why I would see trails unless I was actually making this thing happen for real.
That's fucking whacked out.
Have I done something? Have I broke through reality?
I was even considering like pills. I remember in senior year of high school, I was just eating Xanax and Klonopin. Like it was nothing. Like just like
you don't consider pills hard drugs?
I guess they are, but at the time I didn't. I just thought like, all right, these are like prescriptions that people get. I was like it's not hard. The doctor put it out at the time. Like, nope.
Yeah, that's the mythology of it, that somehow it's quote-unquote safer because it's pharmaceutical.
Do you guys consider alcohol a harder drug than marijuana?
I do.
No, but maybe because I think because marijuana is illegal at this point, and that's why when you first asked that question, I think alcohol is not as hard a drug as marijuana.
I see so many sequelae to chronic alcoholism in my practice.
Right.
The liver failure, the withdrawal. I mean, people don't. I don't know if they understand this, but alcohol withdrawal syndrome can be fatal. And it's a significant percentage of people who withdraw from alcohol without any help at all, who go through, when they go through DTs, it can kill you. The only other one that I'm aware of that can do the same thing is benzodiazepine or Valium withdrawal. That's also very dangerous. Can cause seizures and stuff, and even death.
It's tough to get a doctor to even hand you Valium anymore. They've gotten so much bad press.
But not hard to get an Ativan or a Klonopin, though.
Right.
That's the thing. Yeah, nobody writes Valium anymore, but they still write the benzodiazepines.
I'm
not saying it's good or bad. For some people, they're great drugs.
I have a friend that thinks that there's only, like the Valium helps them better than the other stuff.
Yeah.
And he can't get anybody to write more than like 2.
Right.
Like, I'm going to give you 2. And he's like, what? I just told you my neck's broken.
Right. Valium's a great muscle relaxer, and it's really good for vertigo. For people who have vertigo that everything else doesn't work for, giving them a couple of doses of Valium really is very effective. So it's a very effective drug.
Do some people have vertigo at sea level? Just walking around, you mean?
Oh, yeah. Sure.
Because I wouldn't want to be up on a ladder doing Valium.
No. But you can get a virus that will affect your inner ear, and it will send signals to the brain that you're spinning around. And those people, that's just a viral vertigo or labyrinthitis. And then you get people with what they call positional vertigo, where they've got little rocks that are loose in their skull that are moving around and fooling the brain into thinking that they're moving. And we have all these drugs that we try for it, but sometimes Valium's the only thing that works. So
I'm looking at a lot of people here who not only are they writing up like when they got high, but that weird place that they got high at, the abandoned warehouse. Mm-hmm. There's always those, you go off to a really weird industrial place if you live near a city, or way deep into the woods if you live in the country.
There's a place called The Ditch. That was just a ditch next to some train tracks, like in the middle of asshole Queens, just like in the middle of nowhere Queens.
Smoking next to the train tracks in Queens seems as low rent as you could possibly get.
It was The Ditch.
Here's Dennis. Dennis, you're on the Ron and Fez Show.
Hey, good afternoon, Ronnie. How you doing?
Hey, man.
Best thing ever found as a teenager, 14 years old, my buddy Vinny and I are working in a gangster's restaurant, and we're busting tables. We got turned on to the beauty of nitrous oxide in a cream can.
Mm-hmm.
Yeah.
So we split 2 cases each, laughing our asses off, dropped the rack of glasses, got fired that night, and laughed my ass off all the way home.
I had friends that worked at Denny's, and we went there and did a crate of them.
Nice.
And then later, the fucking owner is calling up the whip places, acting like why none of this worked. Yeah.
That made my root canal the only time I've ever done nitrous was when I had a root canal. It was a very pleasant experience. And
did you get spacey with it though?
Yeah, I did.
Yeah.
I thought I was married to Janet Jackson or some weird dang thing. It was very bizarre. And I remember when they took it off, it's like, well, you can go. And it's like, seriously, I can just go get in my car and drive off? But yeah, I could.
It's because the gas,
it's
only that it's running through.
Yeah.
Here's Drew in Mass. Drew, go ahead, buddy.
Yeah, Dr. Steve, I'm a lifelong addict pretty much. And the strange thing for me is like with benzos, I mean, they really get me up. They get me motivated. I want to do stuff. I mean, maybe there's underlying depression that they help. But, most people take a Valium and they want to sit on the couch. I want to mow the fucking grass.
Yeah. Yeah, it's, anxiety can be really limiting as well. And if it's treating some anxiety, it could, pump you up. Now, we have some people that have this, what we call paradoxical effect, meaning that when we give them a Valium to calm them down, they go batshit. Mm-hmm. And, it may just be having, an opposite effect on you. I don't think we have a good explanation for that, to be honest with you. Now, are you sober in every other way now, or are you still struggling with it?
He's all drunked up right now. It's just going in. He just
is he gone?
Doesn't know where the fuck he is.
You guys in a blackout, really.
Yeah. That was G-Vac. He got totally G-Vac'd.
Good old G.
You ever just write yourself scripts and just think, I'm going to stay home this weekend?
Nope.
And just write a couple of fucking scripts for myself?
Nope. I need 400 Oxy.
I really try not to write scripts for
anyone.
Unless they're in my office and it's under a clinical thing. Because you're just opening yourself up, even if you write yourself an antibiotic for problems.
Really? Even an antibiotic?
Yeah.
So doctors aren't comfortable writing scripts these days?
Some are, but I'm not.
Yeah.
I'm not.
Because it's just not worth it. It's not worth the downside.
It's not.
It sucks to be a doctor, doesn't it?
No.
You learn all that shit, and then you're like this, but I better not do it.
Well, you just got to do it in the right setting. If somebody wants something from me, I say come to my office, and we can take care of that.
No,
I can do some.
Yeah.
there's an allowance for intermediate use of so-called telemedicine, where you're just doing medicine over the telephone, and you can do it, as long as it's not a all-the-time thing. You can call people in something. I have a woman calls and has a urinary tract infection. I can just call her in a prescription for Bactrim or something if she's had it before.
Right.
That kind of stuff.
So you feel safer with that, but, I hurt my knee. No, you're not getting any pills from me.
Yeah, no, that's a tough one.
Yeah.
After hours and on call, calling in narcotics, I want to see somebody.
Right.
So, my job, I'm seeing mostly hospice patients, and it's a little bit different.
You'll give them whatever they need. Just go ahead. Just go to sleep. Go to sleep, sweet prince.
You certainly feel a little better about being a little more liberal with your prescribing practices. Still within safe guidelines, of course, but, it's... most of the doctors will feel, if someone's in hospice, they're going to feel a little bit better about it. And I can fax in a prescription for somebody on hospice. If I write you OxyContin, you have to come get a prescription for it.
Right.
But if you're in hospice, you can just fax it in.
That fucking morphine drip that you just sit there, couples.
And
I'm going to leave this behind. I'm going to leave this behind. Make sure it's only once every couple hours. But if there's any more, then maybe this will end sooner. You ever give that wink?
No. Thank you.
Okay.
Thank you for letting me say
hang
that.
That's good. That's good.
It is good.
It's good that you put it out there. Maybe it's good enough for the whole family. If everybody's been under a lot of pressure.
Right? Dealing
just
with this?
come back and the whole fucking family just laying down on the ground.
Oh, we've had that. I mean, people that will get a syringe and just draw Dilaudid out of the bag for the cancer patients. PCA pump and stuff. And
that's pretty smart.
There's a special level of hell reserved for somebody who steals medicine from, a cancer patient, I think.
I didn't know that you were such a Christian. That's nice.
I don't know what I am anymore,
even having science. Did you say, I think it's up on Drudge, some guy who is a scientist, but a physicist, is saying that death is just an illusion. Just like all time and space.
Yeah.
It's just an illusion.
Well, I don't know. I had an interesting thing that happened to me the other day. I was in the hospital.
All fucked up.
And I just kind of zoned out for a second. But I had one of those infinite moments. And I was neither here nor there. I was just nowhere. Mm-hmm. And it was just for a second, and then I snapped out of it. But it seemed almost infinite. And when I kind of walked away from the table where I was standing when this happened, it just happened out of the blue. I thought, if my life had ended right then, it would have been okay. I just would have ceased to exist, and it would have been okay. I didn't feel that weight of the 20 billion years that come after, or the 13 billion years that come before. And for some, I probably do my job because I'm trying to deal with my own fears about my mortality by, immersing myself in it. But that moment kind of changed my whole feeling about the whole thing because it's the way the molecule works. It's what they call an agonist-antagonist, meaning that in the absence of a narcotic, it acts like a narcotic. But in the presence of a narcotic, it acts like a narcotic blocker.
You always you always tell me, have a little Valium kicker, just because that was always
saying that.
That was always the methadone thing, that you would do methadone, use a kicker, and then you literally spend the weekend, just smoking one cigar. Oh, this was good.
Methadone's a fantastic drug for pain. It's
Dr. Steve, we were just talking before you got here how difficult it is to get off of opiates.
Yeah.
One of the most difficult things there is, right? Opiates?
Sure. Other than tobacco, which I think is one of the hardest things to get off of because it's so socially.
What about sugar?
Sugar's difficult too, not addictive in the same way. I don't think it works in the same pathways.
Have you ever tried to kick sugar though?
Yes.
Everything just comes pouring out of your body.
It's very
You're like,
difficult.
what is wrong with me?
Oh, yeah.
What is wrong with me? And you're like, oh, yeah, the sugar thing.
Yeah. I'm a fan of opiate addiction treatment in their own offices. So you could just go to your own doctor And all they had to do is take a little test. You get this XDEA number, and you can write it. But it didn't work out that way. A lot of the family practitioners and internists just didn't want to mess with it. So now they opened up these methadone or Suboxone clinics. And now we're back to the same situation, except now it's a cash paying thing rather than federally funded. And, it's what I see is a lot of people staying on Suboxone forever.
Sure, why not?
Where
it's nice high.
Originally, we were supposed to, put you on it for the Sugar Busters diet. It's an easy way to get off sugar.
Well, I do it, but I also have some M&M peanuts just to make it a little bit easier.
Right. Opiates difficult, and this Suboxone thing.
Yeah.
It was designed originally for people who didn't want to go through the stigma of going to a methadone clinic. And so you got to go to a special clinic, and you got to be treated by a special doctor, and you got to take a special medicine. So the whole purpose of it was to allow family physicians and internists to do and get you under a maintenance phase and then wean you off of it over 6 weeks or whatever. And studies show that if you wean somebody off Suboxone in 7 days, it's the same efficacy if you do it over 6 months. So there's really no reason to keep people on it forever.
Well, you get that extra, 5.5 months of partying.
If you have chronic pain and you are addicted to opioids, then Suboxone's not a bad choice because it's a really good pain medication too. And the theory behind it is if you take a narcotic with it, then you'll go through withdrawal. And that was